A week from this Monday, the state says it will be doubling the number of people who will be eligible to receive a vaccine against COVID-19. That's when people in Group 1C will join the eligibility pool. Way 31's Will Robinson-Smith joins us live in studio tonight, and Will explains why the state is making this move now and how it will impact the vaccine rollout. Will.
Yeah, Naja, not only is the state expanding the eligibility of who can get a vaccine, but there's also new information on where you can get a vaccine. Now, the U.S. Department of Health and Human Services Resource announced an expansion of the federally qualified health centers that will now get a federal allotment of vaccine. It jumped from just the 2 in the state to now 14. Those include the AIDS Action Coalition of Huntsville, as well as the Northeast Alabama Health Services in Scottsboro. Dr. Scott Harris, the state's health officer, also noted today that with the addition of the Johnson & Johnson vaccine, the state was able to add an additional 131 locations last week that will get the state allotments of the vaccine. Now, with the coming expansion on March 22nd, Dr. Harris says there will be about 1.8 million people with chronic health conditions that will be eligible, along with about 775,000 people in the other essential workers categories. Dr. Harris notes that there is a fair amount of overlap, though, in those categories, as well as with the ones who have been previously eligible. Now, he also encourages folks to consider how much they actually need to get a vaccine now, depending on their circumstances.
You're certainly eligible to get the vaccine if you fall into the category. No one's going to turn you away. But if you're somebody who can stay at home and socially distance and you're not around other people, you know, you're probably not really at high risk, even though you may be a certain age or have a certain health problem.
Dr. Harris says in about a month or 6 weeks, there should be an adequate supply of vaccine. He says the state has been trying to expand the provider network because they believe that having people receive the best care means that they'll get the vaccine in the places where they get their normal medications. Dr. Harris also says that based on some preliminary survey data, about 30% of the state is still resistant to the idea of getting the vaccine. He says that data, though, helps them craft their messaging and helps determine how they will best reach people who are the most vulnerable to coronavirus. Naja?
Thank you, Will. The state is also working on publishing county-level vaccination data to the online dashboard. That update is expected sometime over the next few days.